our platforms are used across the healthcare ecosystem, right? Can you provide some color and context to any differences in the way that hospitals, radiology labs, clinics, and vendors make the most out of having an engine? James, you want to kick this off?
Yeah, I guess one of the major things that's quite funny or interesting with the way that Rhapsody works with when we're working with vendors is it speeds up the integration process so much that the vendors see the added benefit of using Rhapsody, because a lot of the time they'll have a hard time interfacing to a site if they're linking to something or trying to embed their new system on site. Some of the times they have problems. And many suppliers have been so impressed with the way that Rhapsody works, they've taken the Rhapsody specifications, so the way that Rhapsody actually details the different use of the messages that the supplier provides. They've taken those specifications and provided them to other customers and said, here, we can use Rhapsody, and they've actually used it as a selling point. Say, we can use Rhapsody. Here is our specification from Rhapsody. You can drop this in and it'll help you move forward. And also in some other cases, I've got quite a few partners now that are actually embedding parts of Rhapsody within their product. So it makes it much easier for them to integrate themselves, and they use it as a massive selling point to say, we are, not only are we Rhapsody compliant, which everybody is really, because Rhapsody can deal with anything, but also we have Rhapsody embedded, so we can alter, the supplier's saying this, we can alter what we receive, or we can alter what we send you easily because we use the software within, embed Rhapsody, parts of Rhapsody within their software to do that.
Alex, what have you seen?
Yeah, I've seen similar instances in where we are able to use our engine in a variety of different places where they have a lot of systems, which usually there's one EMR, but in some instances there's 2 or 3 in the process, right? And they're trying to consolidate them. And when they realize, okay, well, one system carries the registration information, one carries all of the order information, they have different sources of truth. And one example is the latest project I've done in terms of COVID is that they're taking a lot of time calling up people about their results. And yeah, a lot of them are negative, and so, but they still have to give them a call and say, okay, maybe I have to leave a 2-minute message saying that you're negative and this is what you need to do. I got to call someone else. I got to call someone else. This is on a scale that's they've never had to deal with before. And so when one of their sources of truth has the email address and the other one has the actual registration and the other one has the results, we have the ability to combine all those pieces of information and say, okay, this person has this email address and they have a negative result. Why don't we email them to go look onto the website, because the website will have all the information, instead of having our all of our nurses be stuck on the phone trying to tell them that, yes, they are okay, yes, you're okay, yes, you're okay. And of course, maybe the positives, you do need to take the time to tell them what's going on. But if an overwhelming amount of people are negative, then you're going to save a significant amount of time for all of the healthcare providers that are doing that. And so I've seen Corepoint take different pieces of different interfaces, put them in a database, take a look, and create something that is truly helpful for the public, for the and for the hospital as well. And so it's really cool and really neat how I've seen that is definitely not an original use case of the engine of how they wanted their interfaces to work, but we have access to all that data, and we could utilize that for something really good.
That speaks to the flexibility, I suppose.
Yeah, definitely.